Good afternoon. I'm George Latimer, Westchester County Executive. It is Monday, October 18th, and this is our weekly update report on Westchester County issues, including an update on the COVID-19 outbreak. I'm joined, as I always am, by our Deputy County Executive, Ken Jenkins, and a little later in our update, we're going to have the benefit of our Commissioner of Health, Dr. Charlita Amler, and our first Deputy Commissioner of the Health Department, Renee Recchia, join us to talk a little bit more in detail about how we're dealing with some of the other elements of COVID. We're also going to touch upon the Hurricane Ida restoration issues that are at hand and a couple of other issues that may be of some benefit and some interest. We have some good news on the COVID front. We have now gone 12 days as of through yesterday with no fatalities in Westchester County due to COVID. That number is 2,338 Westchester individuals that we have lost pandemic to date. But over the last 12 days, there have been no additional fatalities. We do not want to extrapolate too far in terms of what the number means. We have seen some diminution in the number of fatalities, but as I hasten to say, every time I talk about a fatality, even one fatality is considered a significant tragedy for the people involved, the loved ones, and the family. So with no minimization, the whole thrust of our efforts in the country, much less in the world, is to try to prevent people from losing their life to COVID. So the ultimate success is how many days can we go without a fatality to COVID? And however many people contract the disease, how many people get seriously sick from the disease, if we can continue to go without a COVID death in Westchester County, then I would consider that to be the best of all possible outcomes, whatever the other statistics are. However, 12 straight days is something that we hope to add to in the days to come. We also have the good news of knowing that our total infections, which we interpret to be a statistic called active cases, is down by about 1,000 cases from the last month. We had at our peak in August about 2,800 active cases. A month ago by this time, we were down to 2,300 cases, and we're now down in very round numbers to slightly under 1,350 active cases. And as I've explained other times when we've had this conversation, an active case is somebody that has tested positive for COVID within the 2-week period of time that is considered the standard incubation period for the disease in an individual. Over a 2-week period of time, medical science tells us that the natural antibodies of an individual will fight off the disease and they will be healthy, or they will become sick and need some additional treatment, in which case the disease lingers. There are other longer-term effects of COVID, which medical science is studying as we speak, long-hauler COVID situations where people have some residual problems, even when the disease itself has disappeared from their system. But those are for another day. For our purposes here today, the total number of active cases over the course of a 2-week period, 1,350 is a round number. And what that basically means is about 100 active cases a day, 100 new infections that have to go through the 2-week protocol. If you count 14 days times 100 cases a day, that would mean 1,400 active cases over a rolling period of time. That's much less than where we were in the summertime at 2,800 and much less than we were in January at 11,500. So we view that as a good sign, and if we continue to see the diminution in the number of active cases, that is a positive for us. However, we are in mid-October as we have this conversation. We've just gotten in the last 2 days the first real taste of the fall. We've had very warm weather, unusually warm weather for the first 2 weeks of October. Most of our outdoor activities have been very comfortable, and now we have to watch to see how the weather changes and what that drives indoors. Outdoor dining becomes indoor dining. Meetings that could be held outside now have to go inside, and if that happens, certainly over the course of the rest of October and November, we will be looking to see if we have a parallel increase in infections that mirrors what happened a year ago, because it was in late October that the numbers started to turn upwards, and it extended from the Halloween season into the Thanksgiving season, into the Christmas, New Year's season, and then the vaccinations were launched in January, and we started to see a diminution of the amount of infections. But at this stage of the game, we have good news on the vaccination front. We'll talk more about that throughout the course of this update. But New York State Tracker points out that we have just hit the 90% mark in terms of vaccinations of all adults 18 years of age and older who have had at least one dose of either Pfizer or Moderna, or have their single dose of Johnson & Johnson. That, in absolute numbers, is just shy of 750,000 people in Westchester County, adults 18 and over, that have received at least one shot. And that cohort that's fully vaccinated, in round numbers, is about 670,000, a little less than that. but in round numbers, 670,000 individuals who have had completed two-shot vaccinations, or one shot if it's the Johnson & Johnson alternative. That puts us in a very high level of vaccination. Since we are not on an island, we as an individual entity cannot talk about herd immunity, but if the whole nation was at 90%, then there probably would be a dialogue about whether or not we've reached herd immunity. But people do wake up in Westchester County in the morning and travel into Manhattan and the Bronx and Fairfield County, Connecticut, and northern New Jersey and the other Hudson Valley counties, and people wake up in those counties and find their way into Westchester. So our numbers alone are not decisive. Our numbers do outrank our neighboring counties, Rockland, Putnam, Dutchess, Orange, Ulster counties, a higher percentage of vaccinations than in the Bronx or Suffolk County. We are also in the cohort of 90% or higher with Nassau County and Manhattan, New York County, which are also in the 90% range. So there is some hope that we'll see numbers that will be for the total of the New York metropolitan area. And when the whole metropolitan area reaches 90% or higher, then I think we will see hopefully a continued diminution in the amount of infections. It is not impossible to be infected when you've been vaccinated, but it is much less likely. And now that booster shots have become available for those who have taken the Pfizer shots, the first two shots of Pfizer, that opens the door for a third shot, which reinforces, hopefully, the ability of the vaccine to fight off infection or severity of infection if one is infected. Again, Dr. Amler and Ms. Recchia will cover some of these topics as we go forward. Do keep in mind, however, that at this moment in time, as of today's conversation, only Pfizer's vaccine has been approved by the federal government, and it has FDA approval, not just provisional approval, but full approval. And we're waiting to see what happens with Moderna and Johnson & Johnson in terms of the booster shot. But a 90% vaccination rate is very encouraging. And keep in mind, at no point in time did we in Westchester County, either with the authority or without the authority, did we mandate vaccinations. But we have gone to extreme lengths to make vaccinations easily accessible. And we have certainly made every effort through the public education format that we have using this and other venues to emphasize what the value of vaccinations are. We understand there's a school of thought that disagrees with that. And in other parts of the country, vaccination rates are much, much lower than what I'm describing here. But in this area, to hit a 90% number is a significant number, and to do so through the voluntary decisions of individuals to be vaccinated, people who come from all different demographics, all different walks of life, I'm very encouraged by that. And I think that hopefully will be a sign of reduced infection in the days to come. We hope. But I have learned from my business career, which had nothing to do with public health, that you don't draw judgments on a week or a month or even a couple of months. You draw judgments about trends over a longer period of time. So we hope that as we continue to see the course of this infection, that we will continue to see some diminution, which will give us the confidence to be able to say we're turning the corner as we go forward. But just to summarize again, 12 straight days, no COVID-19 deaths in Westchester County, 90% vaccination rate for adults 18 and over with at least one shot of vaccination. Those are good statistics to understand as we fight the coronavirus outbreak. We have continued to provide, working with the state, working with Westchester Medical Center, a vaccination facility at the Westchester County Center. Now, the county center has traditionally been used for recreation, for trade shows of all types and sort. We made a big effort 2 years ago to have high school basketball finals come back into the county center. But shortly after that event happened, we made the decision to turn the county center over to state resources, and we partner with the state in making it a central vaccination location. Other ones around the state have been closed down. The county center remains as a vaccination center. It has had a tremendous result here in the Hudson Valley, as well as with Westchester County, and it continues to be a site for vaccinations. We also continue to have our two health clinics, which do a variety of things, and one of which is COVID vaccinations. Our public health clinic in downtown White Plains at 134 Court Street, and our clinic in Yonkers at 20 South Broadway, both of which are also locations where vaccinations can be administered. There are vaccinations being administered at local pharmacies all across Westchester County. If you go to our website, westchestergov.com, you will be able to see a listing of some of those areas and information. However, in addition to those fixed locations, we do a series of satellite locations over short periods of time, and the nickname for that is pop-up locations, as if we opened it up one night, it's there the next day, it popped up. And we have had many of these satellite locations over the course of this pandemic, and that adds to having fixed locations in White Plains, on the White Plains-Greenburgh border, and in Yonkers, by moving them around the county in different settings. And a number of them have been placed in school settings so that we can reach both the teachers and administrators in the school district, and as well those students that are eligible for vaccination. Students under the age of 16 with parental consent are eligible for vaccinations down to the age of 12, and that's important. The statistics I gave you are 18 and over. It is a different metric for those that are under the age of 18, but you cap it at the age of 12. Below the age of 12, we have not yet gotten authorization from the federal resources to administer vaccinations, and we don't know if they're going to be the same size dosage or all of those things. Medical science will tell us, and then we will do our best to administer it. I just want to publicly thank, not just because we have our senior leadership in the health department here, but also all parts of our county government. We have been going through this now 20 months into the pandemic, and almost every single department of county government has had to stretch and twist and accommodate a pandemic that we had no roadmap for, that we had to decide as we went along. No department has done even remotely as much as the health department has in terms of adjusting to this and giving advice to school districts and municipal governments and businesses. At the same time, every part of county government has been affected by this. The way we operate the correctional institution is affected by this. The way our county police department, public safety department, polices the highways and the parks and provides local services in Mount Kisco and Cortland. All of that has been affected by the pandemic. But the health department specifically has risen to the occasion. We want to thank them. And just when I announced these pop-ups, this is a sign of taking you off your normal flow of activities and having to set up a vaccination facility in a remote location for a day, a couple of hours, to try to reach some people. And it is not easily done. And the health department, again, led by Dr. Amler and Ms. Recchia, should be publicly complimented, and the people that work in that department for having to be flexible enough to do these things almost on a week-to-week basis without much advance notice. Upcoming, here are some of the locations that we're going to have. We refer you to the website for specific times because their times may change. We found that in certain locations, the local operating place, the school district, or the community center decides to shift the hours of operation. So I don't want to fix it in, have you take what we're saying here at this particular moment on a Monday afternoon for something that's happening in a week or 2 weeks, and things may change. So check the website for greater details. But at this point, we have coming up on the 26th of October, first dose Pfizer on the 26th at Reformed Church of Cortland Town in the Church Hall. That is in Montrose on the Albany Post Road. That is the first dose of Pfizer on October 26th, upcoming, and they will be back on November 16th for the second dose of Pfizer. That is a localized pop-up. We have the Columbus Elementary School Gymnasium in the west end of New Rochelle. It's located on Washington Avenue. They have a late afternoon into the early evening. First dose of Pfizer planned for October 27th. This is open to parents, teachers, and staff of Columbus Elementary School, perhaps of the whole New Rochelle district. We will be in November at the Rye High School Middle School Complex and the middle school gym. That will be open to the public in the morning. On that date, again, November 13th is the targeted date, and they'll be giving out first dose of Pfizer vaccine. We will then be on October 29th. This is not sequential, but on October 29th, we will be at the Lewisboro Justice Town Court on Boughton Road in South Salem. That's a late afternoon, early evening time frame. We're at Davis Elementary School back in New Rochelle. This is in the north end of New Rochelle, Columbus being in the west end of New Rochelle. In the north end of New Rochelle, the Davis Elementary School. Again, parents, teachers, staff, late afternoon, early evening on November 9th for Pfizer first doses. And then we will again be in Rye in the middle school gymnasium coming up for some additional services there. So with all of that identified, the county government is flexible, and we're prepared to add additional pop-up locations. I'm not sure my health department folks in the room want to hear that, but we're prepared to work with any entity that can identify a proper space for which these satellite locations can be structured, and over a period of time where we think we have the opportunity to get a reasonable number of people in for vaccination purposes. And when we do deal with first doses, we're dealing with a different demand structure than when we deal with third shot, booster shots. Everybody who's gotten a shot already, 750,000 people roughly, will in all likelihood want the third shot, and will have a very high demand for the boosters. The first time, we're dealing now with that cohort of the 10% of adults little bit larger percentage of young people who haven't been vaccinated, and that is a less high demand situation. So we have to work those things out. None of this were part of our job descriptions prior to the first week of March in 2020. We have adapted, and this is why you want to have people with medical experience, public health, master's degrees, and training on the ground to run this department so that they understand how, through their training and education, to do something which hasn't been a traditional part of our job, but became critical for us to do. So those pop-ups are coming up, and we look forward to providing more of them as appropriate to help people get the vaccinations and try to protect themselves against the disease. I'm now going to ask Dr. Shalita Amler to join us here. She's Commissioner of Health, and Ms. Renee Recchia, who's the first Deputy Commissioner of our Health Department. We want them to talk about the work that we're doing with the school districts for weekly COVID testing programs. This is an important program that helps us keep kids in school. We know that children do not perform as well with remote learning or hybrid learning. In-class learning is the best possible way to do this. And so we're committed to do that, but we're committed to do it in a way that's intelligent and pragmatic. And that's why Dr. Amler and Ms. Recchia will talk about this program. So Dr. Shalita Amler, Ms. Renee Recchia.
So I'm going to let Renee begin.
Good afternoon. Thank you for the opportunity to talk about our school-based program for testing. So we were very fortunate. Local health departments receive federal funding through New York State to be able to offer testing to schools. And I really have to commend the administration here and George Latimer for having an ongoing relationship with our school districts in this county. It really allowed us to, I think, collaboratively work out a program that I think is a very robust and comprehensive program. So the way our program works, first of all, it is completely voluntary. School districts have the option of opting in or out, as well as private school districts. To date, we have, I think, almost most of our school districts, I think there's about 2 or 3 that have opted out. They decided to pursue testing in a way that made more sense for them, or opted not to do testing at all. And I think roughly about 16 private schools have opted into the program. So the way the program worked is we set it up initially to allow schools, when kids were returning back, to do what we were originally calling gateway, or sort of a baseline testing, which would allow them to have tested every student or staff member in that school one week. And then going forward, the way we've set the program up is that 20% of those who have consented into the program also could be consented. To talk about sort of the flexibility and having to sort of adjust to new guidelines. Before our program was launched, we sort of had designed it, and then after the program, the governor came out with some standards for schools requiring teachers that were not vaccinated to be required to be tested weekly in order to continue to stay in the school, and to offer to students who weren't vaccinated the ability to also be tested. We met with the county administration here, and we really tweaked our program in order to allow us to help the schools work to meet that goal. We are not requiring teachers to be tested through our program. They have the option of using it or to go somewhere else on their own. But it does at least enable teachers the opportunity more easily to have that testing done on site at school premises. I'm going to let Dr. Amler sort of talk about briefly sort of how the testing is done. But when we set the program up, we didn't want to rely on one agency to do this. Since we knew other health departments were also trying to put together a testing program. So we actually contacted with 3 laboratories. All 3 are very qualified, competent laboratories. They offer PCR, which is sort of the gold standard. We did not want to utilize antigen testing because we do have a process that if you do test with an antigen test, if you get an immediate negative on a PCR, you can actually not have to isolate. So we really wanted to go with the higher standard to enable children to stay in school, and also to identify those who are positive, to identify them more quickly so that we mitigate quarantine. I'm going to let Dr. Amler more specifically speak to the type of testing and how it works for the students and staff.
So good morning. Well, one of the most important things we want to do is keep students in school. That's really, really important to us. So as you heard, we are working with 3 labs to offer in-school testing. And I know most parents have some concerns around PCR, especially parents who have had the nasal PCR where they put the swab up your nose, and some people say, well, it felt like it was going to my brain and was quite uncomfortable. And so they have concerns about putting their children through that. And so the good news is that's not how this testing is being done. So the 3 labs that are involved, 2 of the labs are doing it's a saliva-based testing. So the children or the adults that are involved are actually asked to spit into a small vial. So they provide a little bit of saliva into this vial, and then that is sent to the lab. One of the 3 labs is actually doing a buccal swab. So the cotton swab, special kind of cotton swab is actually inserted inside the cheek, and you just kind of rub it around the inside of the cheek, and then that's put into a vial, and that's the material that's tested. So the good news for parents, teachers, staff at schools, and the kids is that these tests that are being offered are easy. They are quick. It takes us less than 24 hours to get the results most of the time, and they are absolutely painless. And they are free. So I think that is really the greatest news of all. So obviously, why are we doing this testing? The reason that we're doing this testing is that although unfortunately people can have no symptoms at all and be COVID positive, so they can feel perfectly well and still have this virus and still be able to spread it to others. So by doing surveillance screening, we may be able to identify people who are asymptomatic, positive individuals who would be able to spread this disease, find them, isolate them, get them out of the classrooms, and by doing that, prevent spread so that we don't have large, disruptive quarantines that occur in the schools, because I get lots of calls from parents upset and saying to me, how can my children learn if they're not in the classroom? And the one thing we want to do is to control and try to minimize the number of quarantines that we have. So that's very important. We hope that this will allow to do that. And then there's one other thing that I just wanted to add to my remarks today, because we're getting an awful lot of calls from the public wanting to get either their 2nd dose of Johnson & Johnson, their 3rd dose or booster dose of Moderna, and have children 5 through 12 that they're wanting to get a dose of Pfizer vaccine. And although all 3 of these have received FDA approval, they are still pending approval from ACIP, which is a committee within the CDC. And we hope that we will have that second and final approval sometime before or shortly after the start of November. So just hold on. When we get those approvals and we can provide those vaccines, we will let people know, and we'll certainly be happy to help you find a place where you can get your vaccine. So thank you.
Thank you very much again, Dr. Shalina Amler, our Commissioner of Health, and Ms. Renee Recchi, our First Deputy Commissioner of Health. Thank you both for your professionalism. We may get some questions from the press in a few minutes, so we may need your expertise to handle that as well. What I want to just reemphasize in what was just shared in terms of our testing in the schools, we have tried to be a partner as county government with our schools, as well as with our local governments, the villages, the towns, and the cities. The county government is not the superior government to the school district. The school district, the county, the town, the village, the fire district, the library district, we are all creations of the state government. New York state government creates these structures of local governments, and as such, we report to the state in the same way that the school district reports to the state. But what we found was that the cooperation between the county and the school district would help overcome certain barriers that the schools face. And so we were able to obtain PPE, masks, most recently child-sized masks that we've been distributing. I was in Peekskill this morning at Oakside Elementary School, and Ken and I both have been in various parts of the county doing that. What Dr. Amler and her team has done is provided guidance and assistance to try to help keep classrooms operating. Because at the end of the day, we've just said it, all three of us have said it, four of us have said it, that the best structure for learning is in the classroom. That's where young children from elementary all the way up the line have the best chance to absorb the information they need. And in fifth grade, you study mathematics and English, having been built on a platform of what you learned in fourth grade, which is built on a platform of what you learned in third grade. And we cannot afford to lose a year or two without having the whole process of learning pushed back societally. So we don't want that to happen here, certainly in Westchester County, which is our responsibility. And so Dr. Allen and the health department has worked cooperatively with school districts, just as we've outlined, whether it's here's where we're going to have pop-up testing, pop-up vaccination, or the testing program that's been outlined to try to make sure that we understand exactly who is virus-free, who has the virus, who has to be isolated, all the things we talked about at the very beginning of this. And so I want to thank again the health department for their professional work in making these things happen. Before we move on to the topic of IDA recovery, I do want to highlight that for many people, there is a fatigue that comes with dealing with this. And I must tell you, I have the same reaction that anybody else does. When I got out of my car to walk into the building after being out in the morning, I walked in and I reminded that I put the mandate in to wear masks inside the building, so I had to go back to my car and get a mask and bring it and put it on. I only say that to show that I have the same problems that everybody else does, changing your societal behavior. We don't do this to make a political statement. This is not, as far as I'm concerned, I've spent a long time in settings, political settings. We don't do this for political reasons. We do this because of what science is telling us as public decision makers that we ought to do to prevent the spread. So if I put the mask on, I'm preventing you from getting something that I might have, and you're doing the same thing in reverse to protect me and the people around me. We long for the day when there's an all clear sign. And we know that that we can put these masks, in the drawer and not have to come back to them, not have to remember to take them anywhere. Do not believe there's an ideological rationale behind this. There is not. There are people out there who I hear some negative feedback because I haven't mandated a lot of things. There's some other people out there who say unmask everybody, and and I view both of those attitudes as ideological desires to do things. We want to do what is practical in order to do, hopefully, what we're in the process of trying to accomplish. Less infections, less hospitalizations, less to no fatalities. Highest possible level of protection, which we interpret to be vaccinations, and we get back to normal, and then with normalcy, these go by the wayside, and the next vaccination that I have to take will be for shingles or something else in my life, the annual flu shot that Dr. Amler makes sure that I have every year. And the vaccine hesitancy that people have, we treat as a legitimate concern that has to be addressed, not something that we can override with our demand as a government. But by the same token, I would ask each of you to think carefully about what you see. Today, the news came down that the well-respected Colin Powell died at the age of 84, and he died from COVID-related illnesses. Now, it's true he had an underlying condition, he had cancer, and I would say many to most people who reach a certain age in life will have some underlying condition. I dread to think it'll be my day in due time that I'll have to face that as well. But when you lose a person the stature of Colin Powell, to a COVID-related situation. Had that not happened, the expectation is he would have continued to live longer. We would have continued to have the benefit of man of his stature here in our society. This is a serious disease, and you can't just wish it away. You can't use ideology as a crutch. You have to deal with what's real and in front of you. And what's real and in front of us is we have made some strides in terms of this, but we don't know when it's going to be over. We want it over yesterday. I want it over yesterday. But it's not over yet, and while it still goes on, I will personally get my third shot of Moderna as soon as it's authorized, and whatever fear any of us have about taking a vaccination, I view the risk of the vaccination as less than the risk of getting the disease and potentially dying from the disease, as 2,338 people in Westchester County have. And I just encourage you, as you look at the COVID situation, we're tired of it, we want it gone, but it's not done with us yet, and we will continue in Westchester County to do the practical things we need to do to try to deal with those issues as we go forward. Now, if COVID was the only thing we had to deal with in Westchester County, that would be work enough. On September 1st into September 2nd, we were visited by Hurricane Ida, who made landfall in New Orleans, and found her way up the Mississippi River Valley, across Pennsylvania, New Jersey, paid a rather unpleasant visit to Westchester County and other places, and gave us what I would call, by my language, a Category 5 flooding incident. When people talk about 100-year floods and 50-year floods, I kind of throw all of that metrics out. I think that's a bogus way to discuss these things. There's degree of severity, as there are with hurricanes, and I saw personally, I've lived here for almost 70 years, I saw flooding like I haven't seen before. And I saw a lot in 2007 and way back in 1972, before some people's time with Hurricane Agnes. But the category of flooding that we saw was dramatic, and so we are still trying to recover from that. Deputy County Executive Ken Jenkins is going to touch on some of those issues as we continue the process of recovery, which is ongoing and will continue to be ongoing for a while yet. Ken.
Thanks, George. And because it is going to be a continuing effort, there are some important deadlines for our folks to be thinking about. In this case, for our local municipalities, school districts, fire districts, housing authorities, and nonprofits to submit their requests for public assistance for FEMA damage. That is this Thursday, October 21st. So for those entities alone, that they need to make sure to get their applications in by October 21st for public assistance for FEMA damage reimbursements. We also have had modifications in those locations. As the county executive pointed out, we had the site in Mamaroneck. The Mamaroneck site is open every day, Monday through Saturday, at the library, not where it was initially, but 10 to 6, Monday through Saturday at the library. The Yonkers site is now closed. It's closed for early voting. The county executive will talk about that a little bit later. Mobile disaster recovery sites are available at different places. That schedule gets to be popped up. Those sites will be 10 to 6. Tomorrow, Tuesday, Wednesday, and Thursday, that will be at the Greenberg Public Library on Tarrytown Road. So Tuesday, Wednesday, Thursday, October 19th through the 21st. Then on Saturday, Monday, and Tuesday, so this Saturday the 23rd, Monday the 25th and 26th, that will be at the Ossining Public Library on Croton Avenue. And then again on Thursday the 28th and Friday the 29th, the 30th Saturday, back in Portchester Village Hall, back at 22 Grace Church Street, near the back side of the building where the senior center is. Additional locations are expected. And again, make sure to check on our sites to be able to see those particular hours and opportunities. The FEMA teams are also going to door in various communities today in impacted areas of New Rochelle and Scarsdale. They were in Mount Kisco and Irvington last week. Those are going to continue to happen. Again, this is going to be, as the county executive pointed out, something that's going to continue. It's work that has to continue. It's not something that's going to get resolved overnight, and we need to have everyone continue to take advantage of going to see those FEMA locations, filing the forms when necessary to be able to get the assistance that they need. Thanks, George.
Thank you, Ken. And just another word on the Ida recovery situation. I saw a report over the weekend where an individual in Rye Brook was arguing about being ignored and there was no follow-up. Unfortunately, for those people that have been hit hard by Ida, this has been, and understandably so, an extremely intense and traumatic situation, a complete loss of all of their personal goods in some cases, losing their transportation when perfectly fine cars were inundated in water. We had 5 people lose their life as part of this. And we've seen the problems not just in the major areas that we've covered publicly. We've talked about the terrible devastation in Mamaroneck Village, in Portchester, in Yonkers, in Rye, but as Ken just pointed out, in New Rochelle, in Scarsdale, in Hastings, in Irvington, in Mount Kisco, in Bronxville, all over, there have been these impacts. The individual report that I saw was an individual in Rye Brook who was upset and no one's reached out to her. Well, it so happened the very next day I toured the street that was reported on Brook Lane in the village of Rye Brook. I know the area very well, and the houses on the west side of Brook Lane actually back right up to the Blind Brook and were obviously hurt very badly as the water levels rose quickly in the brook. We have not seen flooding of this nature at this high of nature in recent years. There was a flood in 2007 that was very devastating in some of these communities, but it didn't affect everybody equally as intensely. The capital projects that are needed to help us become more flood resistant, the hardening of our infrastructure, are very expensive propositions, and we're working right now with our United States senators, Senator Chuck Schumer, Senator Kirsten Gillibrand, in trying to identify the infrastructure money necessary. Because when somebody talks about having an upstream flood retention program, we're talking about multi-million-dollar public asset, which is not affordable for a small village or a city or a town, and barely affordable by the county in sync with the small village or town. These are major projects that have to be done, and I might add, not everybody in the community feels the urgency to contribute at some level, since not everybody is equally affected by the flooding. Some areas of a community are devastated, and then X number of blocks away, some people are untouched by it and don't want to see their taxes affected by the impact of these public projects. So I understand, and I think we should all understand the emotion and the angst that goes with people who have lost significant holdings and perhaps lost everything. And that is what we're trying to address. But keep in mind, it is FEMA, the national government organization, that is responsible for providing the financial resources to the individual who has lost things. So a person loses all their possessions, it's FEMA that comes in to deal with that immediate situation. The county government has certain responsibilities. We certainly have the responsibility to try to make sure that all the debris has been properly disposed of. The local community picks up the debris on the street and transfers it to the county. The county then disposes of it, working through our relationship with the Wheelabrator plant in Charles Point. And we did things over that first weekend to make the availability to move that debris as fast as possible. And it was replaced by more debris, because that's what happens when you lose everything in a in a setting. We've also been responsible for emergency housing, which we've tried to provide for those people that had no other option, a place to go. Their home is uninhabitable, and they need an alternate place to go, to try to provide that assistance. We work through each of the local governments. In the case of the story that I saw in News 12, we worked through the village of Rye Brook, we worked through the village of Portchester, Rye, the city of Yonkers, the town village of Mount Kisco, every place else where these things happen. But it would be wrong to report that government doesn't care, government isn't involved. We're directly and deeply involved in these things, and I welcome any detailed conversation that anybody in the press would like to have, so we can spotlight some of those things we're doing. This is a major problem. I mentioned COVID already, ongoing, and now the Ida flood is also a major situation. Keep in mind, under normal circumstances, the county government has other functions to do in the health department. We provide vaccinations for those who are underprivileged for normal back-to-school MMR purposes. We provide people in the health department that go out and check the sanitary conditions of kitchens in restaurants, wherever food is prepared and disseminated. We have people in the health department that go out and check the pH quality and the chemical content in pools, public and private pools. There's a host of things that we do in that department, and we run a prison, and we run a bus system, and a host of other things. So when we respond to the emergency of COVID and the double emergency of Ida, we're taking people off of other tasks that still have to be done. And so this is merely not just a matter of rhetoric, and you ought to do this and you ought to do that. This is us trying to organize the workforce of this county at a time when everybody's concerned about how much the cost of government is, and that everybody wants their taxes to be lower, and we try to deliver that as well. But at the same time, we try to deliver the services in an extraordinary period of time where more expectation is placed on government than we've seen in the past. This is a time to focus on results, not rhetoric. And we hope that that's what we're trying to do in both of these issues and in the other issues we face. Let me just mention one more thing. As we look to the future, the calendar has a couple of dates pop out at us. This coming week, from this coming Sunday, is Halloween. We hope that everybody enjoys trick-or-treating on Sunday, October 31st, in an appropriate way. There are some CDC guidelines that we will try to discuss. Maybe next week we'll ask Dr. Amler to come back and talk about that as a bit of a protocol. We know that we're going to be honoring our veterans on Veterans Day on November 11th, as we do each year. We will have both a ceremony at Lasden Park, and we will also highlight that in a number of other ways. Thanksgiving follows before the end of November as we head into the holiday season. And of course, as you might imagine, we have Election Day coming. This year, Election Day falls on Tuesday. November 2nd. It's the earliest possible election day, so it comes very early in the month, Tuesday, November 2nd. We do have, over the last couple of years now, early voting in the state of New York, and so we will highlight that early voting begins this coming weekend. On Saturday, October 23rd, and on Sunday, October 24th, we begin a 10-day period where you can vote by going to one of the designated locations for early voting. It's not your normal voting area, but there are set locations around the county. You will find a list of those by going to the Westchester County Board of Elections website, and they will outline all of the different locations. There are 3 of them in the city of Yonkers, 2 of them in the city of Mount Vernon, a number of other regional sites across the county, and you can vote there in the same way that you would vote on Election Day. If you choose not to vote during early voting, which begins on Saturday, October 23rd, and ends on Halloween Sunday, voting will occur on Halloween. May seem to be sort of prophetic, but on Sunday, October 31st, that will end early voting. The Monday before Election Day, there is no early voting, and then you can vote at your local precinct on the Tuesday, November 2nd. Polls open at 6 a.m., close at 9 p.m. that evening, and you'll have a chance to do that. So put that on your calendar, put Halloween on the calendar, and if you're not going to go out with children or grandchildren or yourself to trick or treat, be prepared for the trick-or-treatsters to come to your front door and greet them warmly and give them a treat. Be prepared to honor our veterans on November 11th, and for all of us to give thanks for the many blessings we have. As many problems as we have infinitely more blessings, and there will be time before November ends to give that the central focus of our attention. With that, I will ask Catherine Chaffee, our Director of Communications, if we have any questions from the press.
We do. We have a number of questions. So the first one comes from Samantha Crawford from News 12 Westchester. It's actually for Dr. Amler, if you want to
Okay.
take
I'm
a
going to ask
walk
Dr.
back up
Amler
there.
and Ms. Recchia to join us in case they may be pressed into service.
Okay,
Both.
so Samantha asks, New York is requiring unvaccinated school staff to get tested each week, whereas the testing for students is voluntary. Can you explain why?
I'm happy to have Charlie to address that, but let me also say to Samantha Crawford from News 12, the state of New York has infinite authority within the borders of the state to mandate things that county governments do not necessarily have the ability to mandate. So I want to caution, when you hear about something is happening in New York City has control of its school districts. Westchester County does not have control of our school districts. That's the way we've been structured by the state of New York. And the state health department is the one that can set authority that we in the county health department implement. There's areas of discretion that the county health department has, but it is also true that the state has mandated authority. With that general proviso, Dr. Amler, if you'd want to address your thoughts on this.
Well, I would just say that New York State Department of Education and New York State Department of Health are really the authorities that make a determination as to what's going to be required for teachers and staff at schools. And so, you know, I can only surmise that they're trying to, as we are, prevent children from ending up in quarantine by preventing them from being exposed to COVID. But this lies within their domain and not the local health department.
Okay. Now we have a few questions from Gary Stern from the Journal News. He asks, first question, how much in federal funding is paying for this program?
Do we know that number at this stage of the game? Renee?
15 million.
Okay, Renee, to the microphone.
So the county received $15 million for this program, and it's for a 12-month period.
Okay. And which school districts are taking part or not taking part in the program?
Do
Do we know that? Go ahead.
I don't know if I have all the names of the schools. There was 3. At this point, I think there was 3 school districts. We could probably get that to him specifically.
Yes,
I just want to confirm, make sure they're completely opted out before I comment.
Okay. When did the surveillance testing begin, and when did it begin?
So our program started on September 20th for schools, and a lot of it was really, we worked collaboratively with them. Again, partly IDA did delay for some of the school districts the ability for us to start this, but we were ready to sort of go with the schools, you know, we'd kind of work with them individually to determine like what was a good start date. So since September 22nd was the first school started.
I think they've been 22,000
On the microphone,
tests.
if you would.
I'm sorry. And my understanding is there have been 22,000 tests done since to date.
Okay. Does the school or district need a certain percentage of staff to participate, and staff and students participate, and how much participation is enough?
They're allowed to decide how they're going to use their testing options. I mean, they're allowed to test 20% of their population at their schools. And it's up to them to decide who they want to offer the testing to. And again, remember, this is entirely voluntary. It's up to the school districts. I don't know if you want to add anything to that, Renee.
I think the bottom line is we're not going to turn anyone away who's interested in having people test. And since it's a completely voluntary program, if a school only has 10 people, I think we'll work with the school. The question is, would we send a team in to be there to do that collection, or would we possibly work with the school to train the school nurse or another personnel there to do that, and then us pick up the test and ship them for them?
Okay. And will the results be returned to the school district or the county? Who acts when there are positive cases?
Yes, it's one of the advantages of the program. The schools, when they are setting up, have access to different portals, and the schools are being communicated those test results, and partly that's to enable us to do faster contact tracing. We also, as the health department, do have access to those test results as well, which allows our team to begin to reach out to the schools and begin that contact tracing to ensure that no additional exposure is occurring.
Okay.
But they would have to be, all positive test results would have to be reported to the state health department.
Okay.
I mean, they go into the CDMS, so they're reported to state health.
How long will the surveillance testing program continue? Will federal funding cover it all year?
So right now, when we did our initial projections, we had based our projections on every school doing a full 100% of everyone from day one for the first week, and then 20% thereafter. So our funding sort of carried us through the end of December, since we had a slight delay in terms of the number of people that initially took on this, and some schools deciding not to do that full baseline. I believe it will extend. Right now, I think internally what we've decided to do is really, check in with the schools probably early November, mid-November, to sort of see how is this working for them, and most likely this program would be extended through the end of the school year, depending on funding.
Okay, last question. You've already mentioned that there have been results already. How have the schools been doing since September in terms of the number of COVID cases?
Well, I can tell you to date we've had 22 positives as a result of the school testing that's being done. But we continue to people get tested privately, and I don't have a way of knowing who those positives are associated with, what school district they would be in.
Okay. That was the last question from the press.
And let me just add, I think the 22 positive cases comes from a pool of 22,000. So it's really an infinitesimal percentage, 22 out of 22,000, that this represents. And I think that is a good sign. Once again, as I said earlier, we don't take any factoid as being an automatic trend, but that is a good sign in terms of the degree of infection, the low level of infection. No other questions? Very good. I want to thank you for watching. We will report again next Monday in a similar fashion, and we will have any updates on anything as is necessary. Last week, after we had our report on Monday, we came back with the capital project budget that was released to the Board of Legislators. You may want to consult with the Board of Legislators website to determine the dates that they have that's already been ongoing for discussion of the capital project budget. And as I said at the time, we expect to release our operating budget on or about November 10th. And then when that is out there, there will be similar public hearings and discussions going on in that particular area for any members of the press that are interested. If any questions come up subsequent to the closeout of this, please feel free to contact Catherine Chaffee at 995-2932, and she'll be happy to get in contact with either Dr. Amler, Ms. Recchia, myself, Ken Jenkins, or any member of our executive team. Having said that, we appreciate you watching. We hope you stay safe. We'll look forward to speaking to you again soon. I'm George Latimer, Westchester County Executive, and have a good day.